Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. So, Monday morning, uh, yet another busy week started, and we are just in the roller coaster of life. And it's good to see everybody morning get connected, start with the talk, and get influenced, get motivated because it's all about natural birthing and normal delivery. So today I chose a topic so that this 1 week we're going to entirely discuss about labor and delivery, and this is about empowering pregnant women or anybody who is, you know, eventually interested in giving the right information for a pregnant mother or taking care of a pregnant mother, be it your sister or your aunt or your mother or your whatever, so wife or your child. So anybody should have the right information regarding the process of labor and the process of natural delivery and normal delivery, so that we encourage natural birthing and normal delivery rates and cut down on unnecessary cesarean rates. So it's all about encouraging natural birthing and normal delivery. So today, the entire week, it is going to be about labor, delivery, and discussion about the intense process of delivery and what all influences in labor and delivery. And now, if we have to talk about labor and delivery, today I wanted to talk specifically about stages of labor. Why? Because this phenomena of stages of labor, if you know, then what influences in which stage of labor is easy to understand. And what is the importance of every stage of labor is easily understandable, and what problems are coming in which stage of labor, you can comprehend and take necessary action. And when it comes to stages of labor, every textbook or every place or every saying that even the doctors or anybody say that 3 stages of labor. But what I feel is, I always say that there are 5 stages of labor, and in that 5 stages of labor, I address it as the first stage for me is, okay, if I can't say it as first stage of labor, but yes, there is a stage that is called pre-labor. And pre-labor is something that just you're nearing your labor time, and you are having that mild backache and lower abdominal pain, but it is not going beyond that. Okay, you get up and you say that you're feeling pains, but then again after half an hour or something, you pack everything, and then in half an hour you will not have any labor pains. So this can be pre-labor, and it can be in that 1 week that you're going to deliver. This is a very good sign, because it means that your body is trying to take you forward into a natural mode of labor. So this is what you have to tell your doctor, that I was feeling like this, and then suddenly my contraction stopped and I was held back. And then the most important thing that you have to do in this pre-labor, or the first part of whatever it is called as, just monitor your baby movements. That's very, very important. And make sure you have everything ready for the labor day. Make sure you have your birth plan ready for the day you're going to deliver, and everything in place, like insurances and the finances and the stem cells and everything, the cord blood collection kits, or everything ready. And then the most important thing again is monitoring the baby movements. If the baby movements are good, and you should keep yourself well hydrated and eat foods which are lighter on your tummy, and make sure you do not have any constipation, because if you have constipation, it can inhibit labor. So it is very important that you are going forward for something that is a natural phenomena, so your constipation should not be there. That is why in many regions and many cultures, they give ghee in this last phase of pregnancy, which helps aid relief of constipation, and it keeps the bowel clean, and it lubricates the intestines, it lubricates the it's a very high source of calcium, it is a very high source of vitamins, it is fat soluble vitamins, get absorbed very well with ghee, and it is going to load you with that energy that is required. And ghee definitely has a beneficial role in the last months of pregnancy. And so this is all about the pre-labor. And pre-labor, you have to be watchful, you have to look about your transports and how do you reach the hospital. And there is absolutely nothing to worry, nothing to panic. Your labor will take very long time, even if you are, say, 600 kilometers or 800 kilometers apart. You can come to the hospital without any fear. So it's only pre-labor, and unless and until you provoke, it doesn't end into labor. So it's very important that you are well aware. And then if somebody who's staying very far off from the hospital can come somewhere closer to the hospital and stay somewhere nearby to the hospital, because you have symptoms and signs of pre-labor. And now the second or the first stage of labor is the stage of labor when you have the active contractions, and that is the time when the baby starts coming down, and it is from the 0 or 1 or 2 centimeters of dilatation till the birth canal opens and the cervix opens. The uterus, the mouth of the uterus opens to about 10 centimeters. That is called full dilatation. Now the first stage of labor after the pre-labor is from starting of dilatation of the cervix, that is the entrance of the uterus, to about full dilatation of the entrance of the uterus, or the full cervical dilatation. Now this is the first stage of labor. And the second stage of labor is the full dilatation happened and then till the delivery of the baby. And the third stage of labor is after the delivery of the baby, from the time of the after delivery of the baby till the delivery of the placenta. Now this is the third stage of labor. And for me, there is another stage of labor, that's the fourth stage of labor, which is all about recovery of the mother. So as important is the pre-labor, that much importance is the recovery of the mother. So here comes two additional things that I have added to, other than the contemporary three stages of labor. So when we talk about first stage of labor, it is very much different for different people. So you cannot compare your first stage of labor to somebody else's, and somebody else cannot compare their first stage of labor, even in their own body in different pregnancies. So first stage of labor is completely different for different people, and different for the same person in 2 or 3 pregnancies that they've had. So first stage of labor can somewhere be between say about 5 to 6 hours to say about sometimes 24 hours also, if it is very much prolonged. Otherwise, it is somewhere between 8 to 16 hours on an average is the first stage of labor duration. Because even if you think that the cervix is dilating, say about 1 centimeter per hour, it has to open up to 10 centimeters. So say 10 hours. So plus or minus here there, if you take 8 to 16 hours is the duration for somebody who is first time pregnant mom, and for somebody who is going through labor and delivery with good contractions. And now there are at times when the contractions are very good and the woman is highly motivated, the baby is small and the pelvis is roomy, and there are very good muscular women who have done yoga, meditation, Lamaze sessions, and the pelvis is very good, and they have good strength, and they have a very well educated partner supporting her. In such conditions, even for the first pregnancy, first stage finishes off like as if nothing has happened, and they deliver in about 6 to 8 hours. So there are variations in labor and delivery. I have personally seen when I usually check women, I always have a calculation in my mind. I tell them that this is the time you're going to get admitted, and this is the time approximately you'll deliver, and this is different for different kind of people. And since I would want an institutional delivery under my vigilance and supervision, and I would want to be there at delivery, and I would not want any emergencies whatsoever, I usually make sure that I am there during the labor process and delivery process, so that the woman is more confident. So I attend to all my deliveries in person. So I do my practical calculations of when the labor starts and when the labor ends, and what to assist and how to assist where and when. So my team is very well versed with whatever I do, and they are in sync with my timings and the women's timings and how the progress happens when we are all in the hospital, and we take it forward very smoothly. So this is all about experience, and this is all about how you take things forward. And even in the first stage of labor, for some women, contractions come in and then they stop, and once again they pick up, again they stop. This kind of an intermittent contractions do not give good outcome. So they need some kind of a help from from the medical side, that assisting some medications so that the contractions are ongoing. And at times when the labor is not progressing, there is some problem, we at times even just break the water and check what is there, so that the labor accelerates. So this is again a process, and we're going to talk about this entire week about all processes that we augment labor and how we take them forward to give a normal vaginal delivery. And then sometimes in the first stage of labor, when the cervix dilatation is happening, in 2-3 hours the woman delivers, and this usually happens in the second and third pregnancies, because first pregnancy only the duration is so much. Second pregnancies, the duration is very short. They come in labor and they deliver in 3 hours. They come in labor and they deliver in 4-5 hours. So it is like that. And second and third deliveries are highly unpredictable in terms of timings. And if there is any problem like a big baby or a borderline pelvis, it takes its own time to adjust and the baby to mold and come and all that. And only in those situations there is variability in terms of timings. Otherwise, everything happens just as predicted. And definitely the first stage of labor is all about the partner help, the woman who's trying to bear the labor, how stress relief is helping her, how calm she is, how cooperative the labor staff is, how the environment is. All these things influence labor and delivery, and how well motivated she is, how is her mind adjusted to go in for a normal vaginal delivery matters a lot. And whenever women are skeptical, they have doubt, will I be able to deliver, doctor, will I be able to deliver, doctor? So this doubt itself works as a form of inhibition. So when you have an inhibition, then it is very difficult to break that inhibition. And even when good contractions are coming, labor is progressing, they still follow that inhibition and keep asking, will I have a normal delivery, doctor, will I have I always tell them that first and foremost thing that a woman should have in labor is confidence. And it is also about the partner support and partner who has to reinforce this part and keep talking to her and keep convincing her and keep engaging her in different things, rather than leaving her alone for the pain to form. And sometimes first stages are little longer than predicted, maybe because of inhibitions. So very rarely epidural works here, and people start dilating once the epidural is given. And for some people it works both ways. For some people with good contractions, epidural does not work well and the contractions stop. So it is like a double-edged sword. You need to really understand that epidural, for a matter of fact, it is actually not the choice of the patient. It is actually the choice of the doctor, who can assess in time that whether she's going to have a normal delivery with assisted or without assisted, with epidural or without epidural, because the doctor will be able to clearly delineate and identify which is the weakness that she's having, which is the strength that she's having, and where epidural will work and where epidural will not work. Is something really a matter of choice that I make personally when there is any issue with the progress of labor. And at times there are a lot of anxiety issues that happen, and to break the anxiety issues also we give some anxiolytics and some pain relief medications in labor. So this is all about first stage. And when the cervix completely opens and the baby's head comes down, that is the time when the second stage of labor starts in. Now, in the second stage of labor, you need enormous energy. Even in the first stage of labor, you can keep eating and you can keep drinking so that your second stage is well taken care of, and you will have that strength to deliver normally. And first stage of labor, we do not restrict any kind of food, or whatever light amount that she wants, she can take, as we have discussed in our class of about food intake during labor and delivery. And when the second stage comes in, now it is all about the entire team, the doctor, the nurses, the doula, the labor physiotherapist, the partner, the pregnant woman, and the family members to support her and encourage her to push so that the delivery of the baby happens. And sometimes after full dilatation also, there is variation in terms of delivery. Some people deliver in 30 minutes, some people take up to 1 to 2 hours. So unless and until the heartbeat is good, you should wait for it to happen naturally and try to motivate the pregnant woman. And if there are any issues with the pelvis, you can mobilize her, you can give her different kind of positions, and you can support her. And if she's not comfortable lying down, or you can make her squat, or you can make her sit, or you can make her walk, you can make her dance if you want. But anything and everything happens when the heartbeat of the baby is good. And in the first stage of labor also, there is regular heartbeat monitoring depending on the criticality of pregnancy. Once in 15 minutes we monitor, sometimes continuous heartbeat monitoring we do, sometimes even there is a method of monitoring the heartbeat with sticking a small electrode to the scalp of the baby. And there are several mechanisms that do work, and we judge what has to be applied to which pregnant lady at what time. And even in the second stage of labor, when everything is ready, all the workforce is ready, and we're trying to push the baby out, sometimes even the the doula or the chief sister or the husband helps the mother, try to push, try to elevate her, try to support her and give her good position, give her position that she's really comfortable in, and then deliver the baby. And in such situations, it is all about motivating the pregnant lady, and it is all about giving her the energy, and the more than physical energy, the mental energy to do this job. And at times it is all chaotic, and she is into a trance world and she's not able to understand. Everything works at this point of time. And maybe it's nature who has put her in this spot. When she is anxious or there is anxiety that is there, she will be not in a mode to comprehend things. All that what we have to do is encourage her so that the delivery happens. And once the delivery happens, we give the baby to the mother's side, cord intact, and we do not cut the cord immediately. It is all about giving that extra blood that goes to the baby, and till the cord pulsations are on, it is the baby side blood that is moving, and we give the baby to the mother. And at times if they are so much motivated, that at times immediately we start breastfeeding, we start engaging the mother with the child, skin to skin contact, bonding starts, all these things. If the baby is not having any issue, any breathing problem or any cry problem, we just give to the mother side and make sure that she enjoys the moment along with the partner. It's absolutely their me time, and it's absolutely their entire pregnancy's outcome that is there in front of them. And the mother, the partner, and the baby have their own sweet time at that moment, and that's a very happy moment, and it's all about enjoying that moment. And this is about the second stage of labor, up from the opening of the cervix till the delivery of the baby. And at this time we have interventions like cord blood collection, we have interventions like keeping note of how much the blood is losing, and at times we need to give some small incision called episiotomy. Sometimes we give, sometimes we don't give. It all depends on the need and necessity and the personal choices of birth plan that the women have, and the social customs and practices that they have. So it's all about being safe. It's all about monitoring the amount of blood loss. It is all about monitoring the amount, monitoring the vitals of the pregnant lady also. And once the baby is delivered, and we, after say about 3 minutes or so, 3 to 5 minutes or so, we clamp the cord and we hand over the baby to the pediatric side after the mother has enjoyed their own time, and then we hand it over to the pediatrician so that the initials of the baby care will be taken care, and then the baby comes back again to the mother within say about 20 minutes or 30 minutes by the time the mother is all stabilized, so that feeding starts. And now in this time the third stage of labor commences, and third stage of labor is after the delivery of the baby, after the cord is cut and handed over till the delivery of the placenta. Now this phase is one of the most important phase in any pregnant woman's life, because it is all about her safety. Now the baby is all delivered and given to the pediatrician. It is all about the mother's safety, and it is all about the blood loss that happens at this time is impacting her entire post delivery time. So there are two types of management, that is the easy management and what is the active management. The easy management goes in the way that we just wait for the placenta to come out all by itself, no intervention, nothing, and say it's about half an hour time the placenta takes to expel, and one more push the mother gives, the placenta comes out. But there is another stage of labor, there's another method where there is active management of third stage of labor to cut down on the blood loss that is happening in the mother. So in this stage, in active management, what we do is we give some medications, and we with controlled mechanism we deliver the placenta and make sure that the uterus contracts by continuous massaging. So by this method we have a better third stage of labor and a well controlled blood loss and a well controlled healing. And now in the third stage of labor, there happens to be sometimes emergencies, like the uterus is not contracting and there is heavy blood loss, and at times the placenta refuses to come out, it is stuck, and all these things have to be taken care and settled as per what are the findings that we see. And all this is about this third stage of labor, which is one of the most dangerous stages for any obstetrician to have a nightmare. It is not about the labor and delivery we are much scared of. We are much scared of the third stage of labor, wherein there can be blood loss issues. There is an alternative, like if there is any heartbeat changes in the baby or any problems, we have a cesarean as a backup for the safety of the baby and also for the mother. But then in the third stage of labor, if there is blood loss and the uterus refuses to contract, there is an emergency. That's an emergency phase where that it's life threatening to the mother also, and medically also there are so many things that involve. So that is why I always talk about a correct setup for delivery. Even there are thousands of deliveries happening in small setups, also deliveries happen, but why a bigger setup where a blood bank is available, a bigger setup where all labor team and high ICUs are available is important for pregnant women is, in third stage of labor, if there is any issue, you will have a backup of blood products, you will have a backup of intensivist, you will have a backup of anesthetist, you will have a backup of anything that you would ask to save the life of the mother. So that is very, very important, and it is really, really important to have a control of this phase. But yes, in natural labor, it is all normal, and 99% of the time everything happens normally. You have minimal assessment, minimal issues that come in. Yes, there are issues that are there when you have big babies, or when you have high risk pregnancies, or when you have a lot of water, more amniotic fluid, or overstretched uterus. The chances of having or some hypertension or some diabetes complications or an obese mother, all these can lead to a turbulent third stage of labor. But then if everything finishes off well, then the suturing is all done, and the mother is stabilized, and she enters the fourth stage of labor, what I called it as recovery. And now in recovery, we just try to mobilize the mother and give her comfort and give her something to eat, because she's all stressed during labor, and give her something orally. If she's having any chills, we give her some support with a warm blanket and leave her alone for some time, so that she recoups from all the experiences of all the efforts that she's put for labor and delivery. And once everything is settled, then the baby is almost in the way, and we start breastfeeding, and the saga goes on. So this is all about a beautiful experience of stages of labor and how the pre-labor to the recovery of the mother is really important, and every stage is really, really important. And this entire week we're going to concentrate only on the labor process and what influences labor and what influences where and which part of labor. So this is all about today's talk, and thank you all for watching. It has been, I did not know that I would talk so much about labor and delivery, but yes, the information has to reach and it is all about education, it is all about empowerment, it is all about knowing things. And let us take this beautiful journey of pregnancy into a beautiful journey of labor and delivery by natural delivery and normal labor. So catch you again tomorrow morning 7:30 live in Super Healthy Super Mornings with Dr. Shilpi. So that's all for today. Catch you up tomorrow.